Hello, I am Renee Ladmer, Senior Director of Professional Development and Educational Technology at American Dental Education Association. I will be presenting to you today on the ADEA Academic Dental Careers Fellowship Program, also known as ADCFP. The purpose for this presentation is to give you a general understanding of the program and perhaps spark interest. So, what is ADCFP? ADCFP is for faculty and is aimed to improve the climate at dental schools and allied professional programs and advanced education programs for non-clinical careers in dental education. Students are provided insight in the life of faculty, educators, or researchers. ADCFP was created because many schools had a less than positive view of the faculty role. In many student focus groups, they heard faculty were overworked, or if faculty was part-time, then they felt like they weren't compensated enough. So we needed to provide a positive environment after talking with students and faculty in focus groups. Students needed to see that an academic and research career can be enjoyable and a viable option. ADCFP started in 2015 with over 41 US and Canadian institutions. Over 748 students have completed the program to date. At this time, this program has been open to academic dental institutions such as dental schools, allied schools, advanced education programs on a campus connected to a dental school. And that's because initially this was funded by ADEA, and this is where the program started in a pilot form. Over the last few years, we have been able to expand ADCFP to all ADEA members, regardless of being an academic institution or not. And comparing the original to the current pilot, you can see the evolution. We want to discover potential future faculty in a positive environment. The rationale now is that it's really a rewarding career. The program objectives are clear in this PowerPoint. For faculty, we want to broaden the pipeline of students interested in academic dentistry and research. We want to implement and foster a culture of teaching and research. And for fellows, we want to provide an opportunity to explore career pathways within academic dentistry. We want to also provide professional training specific to teaching and research, and we want to further expand the peer and professional networks of students, along with enhancing engagement with faculty. So, how does this all work? We have three program participants. The first participant is the ADCFP liaison, and this position is the liaison between ADEA and the institution. All ADEA communications will be sent to the liaison. And then you have the faculty mentors. Some schools or institutions have more than one mentor, and this is perfectly fine. And then you have, lastly, the student fellows. The mentee and the mentor will spend the year through this program together. The next slides are brief details of each role, more specific. More specific. So the ADEA ADCFP liaison is the ambassador of the program. For new ambassadors, there is a 1 hour mandatory virtual training that we will have in January or February before our annual session and exhibition. I know normally this was held in March, but we're going to push it up um, a month or two, and it will be held virtually. Also, the liaisons arrange 1 to 2 meetings to answer questions from interested participants. This position keeps ADEA abreast on any changes or updates of students and mentors. The faculty mentor will co-create a plan with the student and meet bi-monthly in person or virtual. Again, there's flexibility. It's really up to the university or the institution and the between the mentor and the mentee to really decide. This position provides mentorship and assistance with teaching research projects. This position also manages the fellows' progress during the duration of the program. So the student usually starts in May through December. Each institution, their timeline may be a little different, but for the most part, it's between May to December. At the ADEA annual session and exhibition, the student will present a poster on what work was done through the program. The student has to select a mentor that is available. If you don't happen to see a mentor that is involved, perhaps the student can share the ADCFP information on our ADEA webpage to spark interest. The mentor can also select the student, and this process should not be forced but more organic. This program can be for students that are D1, 2, 3, or 4, students in pre-doctoral dentistry, allied dental students, and advanced educational students um, can also apply. And again, there's lots of flexibility here, and each institution can create their own program. ADEA provides all the tools, and you can decide which parts works for you. So the ADCFP has many components. The most important component is creating the action plan and bi-monthly meetings. We like students to begin and conclude with a reflection essay. Setting up meetings with faculty and administrators to help answer your questions are very, very helpful in this process. And students can be in a teaching or research practicum. Some students at the end of the year create a poster of what they learned. Regardless of whether a student participates in presenting a poster at the ADEA annual session and exhibition, they will still receive a certificate in the end. The completion of the program has been used for portfolios such as honor programs and postgraduate applications. So I will show you briefly what some of these items look like. And again, if interested, further training is given to new liaisons earlier in the year, January and February. And you can contact me at latimer@adea.org for further training. But bringing this program to your school will allow full support from ADEA. We provide toolkits and around the clock support. So, some examples of the fellow mentor action plans are attached. Um, the students' personal objectives for the year should be figured out. How often you will meet? Will it be bi monthly, monthly, quarterly? Will it be virtual or in person? A sample action plan would include the list of bullets that we have here. What is the student's personal objectives? This is where you'll have to identify whether it's a teaching activity or a biomedical research project. Sometimes faculty and students develop a syllabus or a lecture from a D2 to a D1 perspective. Um, Research practicum examples could be creating a research project with IRB. Some students have more than one mentor. It's really, again, up to the institution. And so the bi-monthly or the meetings should be decided during the action plan to figure out what your frequency should be. The career reflection essay, we ask for at least 2 essays. The first one should be in February and the last one should be in March. And in this PowerPoint slide, I'm giving you an example of when those essays should be completed around the time frame. Faculty and administrator interviews are essential during the essay portion of the program. These interviews should be to answer prepared questions, and these interviews should be um, a maximum of 30 to 45 minutes long. A 2-page essay reflecting on the overall impression is important. ADEA will provide advice on how they are constructed if need be. ADEA provides a list of different faculty types of who would be good for the mentor position. Um, some faculty would be the assistant professor in teaching or research, or a tenured associate professor with appointments emphasizing in research. In our toolkit on our website, there are sample questions, and many of those questions are listed here that you can use. Like, how long have you been in your present position? Describe a typical day for you during the school year. We have plenty interview questions on our website. So, the teaching track. We recommend one teaching experience each semester. There are 4 educational settings listed here that can be useful. It's the classroom, preclinical lab, small group seminar, conference, or clinic. So students can develop or review objectives, PowerPoints, and handouts, and the mentor will guide the topic selection. And the mentor should always be giving helpful feedback. And the biomedical teaching track. Some examples of the biomedical teaching track are focus and title of a research project, synopsis of the project, rationale, study design, methodology, research questions, your role in the project, and name of faculty members who will supervise. Other activities that can be considered, the fellows should have the opportunity to also attend academic meetings as an observer. Some faculty have taken students to IRB meetings, or they've been invited to a university-wide meeting. It's all about one's experience, which is the key method of learning, and writing a reflection paper around that experience. So some other examples of networking are informal meetings, monthly fellow meetings led by different mentors or different fellows. In these meetings, you can discuss and share experiences. Some universities will bring in guest lecturers, or they'll discuss reflection papers. Some have debates around journal reviews. The poster presentation. Poster ideas at the ADEA annual session and exhibition. These ideas can include assessments of the teaching assignments, including insights about learning from the instructor's perspective. This is the teaching track. The summary of impressions and findings about academic dental careers derived from faculty interviews. So these are just some ideas listed here. In regards to the poster presentation held at the ADEA annual session and exhibition, schools should fund students in total to attend, and this includes sleeping rooms, meals, flights, etc. Participation is not required to complete the fellowship program. We encourage a poster presentation to be presented not only at the ADEA conference, but also at the home institution. This will show all the students your hard work and hopefully motivate others to sign up the following year. The final portfolio. The sample ADCFP final portfolio should include the fellowship plan, bi-monthly meetings, and reflection essays. Some institutions complete all of the sequence that you see here listed. Some create their own. In the end, it's about the relationships being created and creating an interest in academic research and or clinical careers, and knowing they are equally viable and rewarding. So what is next? Mid-November, we will have early registration. That will be on our website at www.adea.org to our ADEA annual session exhibition in Philadelphia. And in January and February, we will have a 1-hour training for new ADCFP liaisons. February and March, completion of recruitment of faculty and students should be provided to ADEA. March, April timeframe, the action plan for your institution should be completed. And lastly, the ADCFP certificate event will be held in Philadelphia this year at the ADEA annual session and exhibition. All confirmed dates will be available on our website at www.adea.org/dental Please feel free to contact me with any of your questions, and thank you for listening to this recording.